Commissioners, are there any questions about any items on the agenda for our briefing meeting today? And is there any other topic that anyone would like to have some discussion about at the briefing meeting today that's not already on the published agenda? All right, then we'll follow this agenda for the meeting. Are there any questions about any items on the agenda for this evening? Very good. Then let's move on to the first staff update, and that's on the COVID response, and Stacy Saunders is here to help us out with this item.
Good afternoon, Commissioners. Thanks for having me. Today we are going to do our COVID update, and just some reminders that we'll go over the current COVID situation. We'll talk about our vaccine rollout and then what's on the horizon. I did want to start first with our epi curve and give some updates around that there have been 23,001 total cases of COVID-19 since the pandemic started. 351 Buncombe County neighbors have died related to COVID-19. And while the pace at which the cases are increasing has slowed, and I'll talk a little bit more about that slightly in the last 2 weeks, we are currently seeing levels similar to the middle of January when we had case rates that were close to 400 per 100,000 per week. So the current incidence is about 366 cases per 100,000 per week. This is virtually unchanged from last week, where it was 365. So we are seeing just a slight slowing in the increase in cases. On average, about 129 new cases per day enter our public health workflow. This is an increase from about 120 last week. And so there is a slight slowing in the rate of increase in cases, which has me hopeful, but also very cautious because cases do remain very high at this point. Percent positivity remains high as well, but has remained below 10% for the last 2 weeks. The percent positivity has stabilized in the mid 9%, with today's value being 9.6%. Again, while stable for the last couple of weeks, this is a far cry from levels just in July that were well below the desired 5%. You might remember at that time we were seeing levels as low as 2%. The highest rates of infection remain in our 25 to 49-year-old group. However, cases in our school-age population has increased over the last couple of weeks as the school year has begun. And on this particular slide, you'll notice that the green at the bottom is the 0 to 17, so that's our school-age group. And they're showing a larger proportion of cases than they have in the past. And just a reference, our older populations are the very top two, and you can see showing less proportion than they have in the past. And they're our group with the highest vaccination rate. In terms of regional hospitalizations, we continue to see high levels of hospital utilization. And as I've said several times, following a time of rapid case increases, we will then see an increase in hospitalizations within a few weeks. Beginning in mid-July, we saw a rapid increase in new cases coming in, which was then followed by a significant increase in hospitalizations. Unfortunately, high levels of cases also often lead to high levels of hospitalizations, which in turn typically means an increase in deaths as well. And while not at the levels we saw in January, where our deaths were at 12 per 100,000 per week, the rate of death has increased to 3.1 per 100,000 per week from 1.1 just last week. Hospitalizations are a lagging indicator, and with case levels still really high, it is expected that we will see a high level of hospitalizations well into September. Dr. Hathaway is with us today, and we'll be talking more in depth about that current hospital system COVID-19 situation when I'm completed the vaccine pieces. So before moving on to vaccination rates, our weekly metrics have been updated, and that's what you see in front of you now. As I said, cases continue to be high. This indicator remains red, indicating high transmission. The percent positivity, while stable, far exceeds the desired state of less than 5% and remains in the orange. As mentioned earlier, as hospitalization increases, it is likely that additional deaths will be experienced, and our death rate has increased now to 3.1 per 100,000 per week and now is in red. Hospitalizations continue to increase from last week and remain high, stretching the capacity of our hospitals. And then our vaccination rates are at the bottom, but I'll talk more about vaccination in depth now. One of our greatest tools to help control and manage COVID-19 is vaccination. Vaccination is not only a tool to help control COVID-19, it is our greatest tool in reducing severe illness, hospitalizations, and death amongst our population. This slide shows the very wide gap of risk between the vaccinated and the unvaccinated regarding illness. That orange-looking line is the vaccinated, the blue or darker line is the unvaccinated. The unvaccinated have a risk of getting COVID-19 that is 4 times that of their vaccinated counterparts. Additionally, the unvaccinated have a risk of COVID-19 related death that is 15 times that of their vaccinated counterparts. And I just want to repeat that, 15 times more likely to die if unvaccinated. So again, this is why vaccination is so very important. Currently, about 63% of our total population is partially vaccinated, and just about 60% of our total population is fully vaccinated. This leaves us still a large proportion of the population not vaccinated and at higher risk for illness, which then in turn is higher risk for hospitalization and death. In the recent weeks, we have seen a slight uptick in vaccination administration across the county and also in our clinics. 2 weeks ago, when I talked to you all, I was excited to see the first glimpse of an upward swing in vaccination. And standing here today, it appears that that has leveled off just a bit. And though our clinics saw a very large increase last week that I'll talk more about in a little bit, but I am hopeful that we'll see another upswing as vaccination data from last week is entered and added as well. Vaccination is, as I've said, one of our greatest tools, and in this time of very high transmission, it will take vaccination and a layered approach to succeed in controlling and managing COVID-19, as we've done here. So increasing our vaccination rates coupled with our county-wide face covering requirement and all of us remembering to also put some space between us and others and limit our interactions, we can begin to push down COVID-19. I did want to talk a bit about our different vaccine operations. Buncombe County HHS has administered over 98,900 total vaccine doses since December. We continue to offer vaccinations at the fixed site, which is located at 40 Cox Avenue, where the health department is, and it's being well utilized weekly, and continue to support vaccine outreach events throughout the area, including local schools, community centers, homeless services, food pantries. This week, I believe we're at work sites. And in addition to the community outreach, Buncombe County HHS provides and has provided at-home or homebound vaccination services. In the beginning, in partnership with Meals on Wheels and Mission Care Partners for the homebound. At-home or homebound vaccination services are available through Buncombe County HHS and throughout the state. If you're listening to us and live in another county, you can follow the website on this slide to learn more, and individuals who are interested in this in Buncombe County can visit the website or give us a call at 828-419-0095. And additionally, you've heard me talk about the Fema vaccine resource. It has been very successful in providing over 600 doses of vaccine in its first run in our region. And currently, the Fema team is deployed to another region in the state, but will return, I believe, to our area in October. I did want to spend a moment talking about the Buncombe County HHS vaccine teams and other community partners and vaccine providers and the efforts they've put into equitable distribution of vaccine. The area vaccine providers meet regularly. That includes the Public Health Department vaccine operations, FQHCs, community health centers, our pharmacies, many other vaccine providers, to create plans and provide vaccine to needed areas. And as a result of this continued partnership between providers with a focus on equity, we have reached many vulnerable areas by sharing information and spreading vaccination opportunities amongst all the partners. This map, albeit just a bit busy, displays census tracts by social vulnerability and vaccination rates. I do apologize that the county lines don't show up quite as well. That's hence the black box to give you an idea of where to focus. Blue and shades of maroon and purple are favorable. In particular, the purple shades indicate areas of high social vulnerability and moderate or high vaccination rates, whereas the blue indicates low social vulnerability and moderate or high vaccination rates. Shades of cherry red, which you can see outside of the black box and to the east of us and to the far west. Shades of cherry red indicate high social vulnerability and lower vaccination rates. So at this time, we have no areas of bright cherry red, and this is in part because of the hard work of all those vaccine providers in Buncombe, like I said, that include not just your health department, but community health centers, MAHEC pharmacies, state vendors, many vaccine providers who are all talking to each other, collaborating, sharing information, and dividing the vaccine load. There is still work to do, particularly in some of our areas that have high social vulnerability and have moderate vaccination rates, moving them into high vaccination rates. To close out the vaccine update, we have seen a really good response to the Department of Health and Human Services Summer Incentive Program. Prior to the program, we were administering less than 200 doses per week, but since the program began, we are averaging 400 doses per week, and last week was a banner week where almost 550 doses were administered and almost 310 of those were first doses. So that was incredible to see this morning when the numbers were pulled. Since the program started on August 4th, over 860 individuals have received $100 for receiving their first dose, and almost 120 individuals have received $25 for bringing someone to their first dose. Department of Health and Human Services has allowed an extension of the program until September 13th while supplies last. So we encourage eligible individuals who have not received their vaccine yet and are interested in this incentive program to come see us, and come see us soon, before the program expires or before our cards run out. And just a reminder that to be eligible for the $100, an individual must be 18 years or older and be getting their first dose. And to receive the $25, an individual must be 18 years and up and transporting an individual who is getting their first dose. So what's on the horizon and next steps? Given the stabilization of our percent positivity and the slower rise in cases, there are no new recommendations at this time, but we will look to review and evaluate the need to remove or extend the face covering requirement at the September 21st meeting, and any other recommendations should the COVID-19 landscape change in that time. Buncombe County HHS Public Health continues to provide consultation to our local schools. Now that school is in session, both public schools and charters did implement universal masking K through 12 and adopted many, if not all, of the recommendations listed in the Strong Schools Toolkit regarding social distancing, ventilation, and many other things. In addition to that, Buncombe County HHS Public Health, in addition to our current vaccination efforts at the fixed and outreach sites, we are actively planning for anticipated boosters for the general public, not to be confused with the third additional dose for those who are immunocompromised, but the boosters for the general public. And while there is still no official word and no official guidance that has been given, we are planning now in order to best meet the needs of the population. This plan includes operations specifically for boosters, as well as maintaining fixed site operations for those still needing first and second doses. So more details to come on that, as the nuances to that planning are heavily dependent on the timing of the official announcement and the criteria of eligibility. But I did want to say, just a reminder for those who are immunocompromised, the CDC recently recommended a third additional dose for those who are moderately to severely immunocompromised. Those who received Moderna or Pfizer and are moderately or severely immunocompromised can receive an additional dose of vaccine in order to better protect themselves. Individuals must self-attest that they qualify for the third additional dose by having a condition or taking a medication that causes them to be moderately to severely immunocompromised. Buncombe County HHS can administer those doses at our walk-in clinic at 40 Cox and at mobile outreach events. Additional doses can be secured at any vaccine provider, and individuals do not need to go back to where they got their original doses to receive their third additional dose, should they be eligible to get one. And just a reminder that the recommendation does not include individuals who received the J&J vaccine at this time. So before turning it over to Dr. Hathaway, I wanted to also remind everyone that if you are experiencing symptoms of COVID-19, please get tested and isolate right away while you wait for your results. If you have not received your vaccine, now is the time. Case numbers are high, transmission remains high, your risk of illness, hospitalization, and even death is far greater if you are unvaccinated. Don't take that chance with your health. Please don't let COVID-19 take control of you. And I'll end with vax up and mask up. It is this layered approach right now that we have in Buncombe County that will help us control and manage COVID-19 and reduce your risks for spreading and becoming infected with COVID-19. So now I'll invite Dr. Hathaway to the podium to give his update regarding the hospital situation.
I think there might be a couple of questions before Dr. Hathaway comes up. That's okay, Stacy. Jasmine, do you have a question or comment?
Just a couple. Thank you so much, Stacy, and thank you to staff for the continued really tremendous efforts underway. I just had a couple questions and then a couple of things I wanted to put on the table for discussion. Can you just talk with us about what your thoughts are, given what you're seeing around rising childhood cases and what level of concern?
Yeah, thanks for the question. So for the last couple of weeks, we have seen the proportion of those who are 18, younger than 18, that case rate go up. Probably not unexpected, given that school is coming back in. Many of those first waves, though, were probably exposures outside of the classroom. We have two public school systems that have universally decided to mask K through 12, which is one of the best ways that we're going to stop the spread. And they're adhering to, if not all, many of the recommendations that are in the Strong Schools Toolkit. So I do expect that we will continue to see more, those cases in children. Many of those, though, the exposure is likely to be outside of the classroom and as they're coming back into the classroom. So the big thing to remember for families and caregivers is that when outside of the classroom, and that means when you're in extracurricular activities, sports, out with your family, in your neighborhood, to continue to practice distancing, masking if you're going to be indoors, and if your child is eligible for vaccine, to get them vaccinated if they're not already. Within the school setting, they're taking very many precautions with the social distancing, the masking, the way that they're setting up classrooms, the way that they're ventilating classrooms and taking things outside so that folks can be spaced out and better ventilation. But we likely will see that those cases coming in.
Okay, thank you for that. In terms of the vaccination efforts, if the state funding is set to expire on the 13th, can we authorize or approve something so that local funding could step in there and ensure the continuity of that incentive program?
I don't know that I can answer that.
That would be a local funding. So yes, you can do a budget amendment to move some of the contingency or some fund balance to a program that we could run and do the same thing that they're doing.
It couldn't be used off the 1 million we've authorized?
I knew the state got special authorization to use ARPA money or CARES money to do that. So we would have to look into see if we could use that money.
I thought it was
Okay.
like, okay, yep.
Well, I think given,
That
so
it was like, that's kind of the sort of thing it was for, right? Like, but you would double check and make sure they're.
We would need to double check the actual paying of the incentive to an individual.
is there any way we can make that happen so that the service is not interrupted on the 13th?
I'll just add that with this extension till September 13th, actively talking to the state too about what the future of the program is. So as I learn more details, I'll be happy to share them.
I'd just like to make sure we're on our toes on this. It seems like it's a program that's working at a time when we need to spur people getting a vaccine and would hate to see that interrupted. So if, we won't meet again until the 21st unless we call a special meeting. So if there's action we need to take, would we need to add that as an agenda item this evening?
You would, and you can make it contingent on whether or not we could do that, but I will try to get some answers between now and 5 o'clock.
Okay, and I guess the question for board members to mull over is whether we have the unanimous support to add that as an agenda item. The final thing I'd love to just ask is, you all are just doing tremendous work through a lot of different strategies, and it's obviously working to spur a lot of people to get vaccines. And then we know there's another group of people in our community who, under the right conditions, will get vaccinated, but that hasn't happened yet. And we've had a lot of commission level discussion in the past week, and would love to hear from staff at our next meeting some ideas about what it would look like to stand up a, say, month-long campaign, for instance, to really push to increase the vaccination numbers during this critical period, where there's a sort of concentrated effort with these strategies, where it's blasted across sort of every media channel that exists, outreach to folks. It's building on what you all have been doing, but in a way, I think, where, especially with people experiencing such fatigue around these issues, it's easy to tune out, and just trying to really do a big push so that we are doing everything we can to maximize adult vaccinations, and then hopefully the children's one will be available sooner rather than later, and we can shift our focus there. But I would love to just hear staff thoughts on what feels feasible there. And, I know there's some funding that's been allocated at this point. I would be open to discussions about whether there's additional funding needs that arise related to that. But I think in this period, especially as we see concerning things happen, like the pediatric cases go up, we're hearing very sad stories about people who are dying related to COVID right now, is just everything we can be doing to sort of put our foot on the gas around increasing vaccination rates and making sure that, everyone who's willing to get a shot in their arm we're doing everything we can to reach those folks. So I would love to hear staff ideas about that at our next meeting.
Great.
Thank you.
Yeah, absolutely. Next time we meet, particularly around some focus with the 18 to 24 and 25 to 49-year-olds, we'll bring back some communications, media, outreach types of ideas. So.
Thank you. I appreciate it.
And two specific things I'd add, sorry, Brenny.
Go ahead.
I guess two specific things on my mind would be, I don't know that I've read about a incentive that exists anywhere for 12 to 18-year-old persons. And I don't know if you've heard of those types of examples, and would love to consider some of those perhaps at our next meeting.
I'm sorry, is that communications and messaging around 12 to 18 years
No,
old?
incentives.
Incentives.
Like, for example, the gift cards is only for 18-year-olds.
Correct.
And, one of our, I think it's 50% of 12 to 18-year-olds have been vaccinated. So I'd love to think,
What
I'd love for all of us to think of incentives for our younger.
What was that percentage?
I think it's 50% is what that slide
50%.
said.
Okay.
49, 50. It's broken up, so I can't do that math. But what was my other thought? Yeah, in the past, Stacy, you've mentioned that you've had success at schools doing school outreach. I'd love to hear if that's still the case. I also know there's several dozen schools within the boundaries of Buncombe County, and so I guess I'd love to hear if you would agree, if you would think it would be helpful. I'd love to hear what you think you'd need from us in terms of resources to perhaps scale that up to double or triple that effort to kind of coincide with some of what Jasmine is considering. So
Yeah, so thanks for that. We have had a lot of success in partnering with schools, particularly in the summer, trying to get many of the student athletes who were eligible vaccinated, plus their families. And we had quite a bit of success. Sometimes they were our most visited, and we administered the most vaccines at those because it's a familiar space. It's a place that folks trust. It's usually a place that they know how to navigate, and faces they're used to seeing, because our school partners were often there with us. And so as we think about particularly those who are less than 12 being eligible at some point, we are thinking through, like, how do we partner with our schools and be as successful during that time as we were in the summer. So planning already, trying to think through that. With school just going back in session, we've sort of backed off just a little bit.
yeah,
To let them get used to the school year and then re-engage about further vaccine outreach.
Stacy, talking about schools, are you through? I'm sorry, I didn't want to hear. I'd like to piggyback on what Parker was talking about, but we hear a lot about masking in the Buncombe County schools, Asheville City schools. We know what's going on with the public schools, but I don't hear a lot about the private schools and the charter schools in the county. I mean, what is going on there? Do we have the same push with them that we have with the public schools?
Thanks for the question. So it's my understanding that the charter schools have followed suit with the public schools and have the universal K through 12 masking and have adopted many of the recommendations in the Strong Schools Toolkit. Private schools are different, and I don't have the breakdown as to which are requiring and which don't, but I'll be glad to get that for you and share it. So the private schools may or may not be doing the masking, but it doesn't. The public and the charter schools are, and masking is one of those layered approaches, particularly a very important approach for children who are less than 12 who cannot be vaccinated.
Right.
So I think everyone in public health was really pleased when both of our public schools decided to do universal masking, because it does allow, it does reduce the risk so that children can stay in a learning environment that is healthy and safe. And we continually have meetings with our school systems and even charter schools and private schools too, as needed, to talk through recommendations, to help them figure out ways to help them figure out ways to implement some of the recommendations that might find challenging, or just to talk through new guidance. So we're continually talking with our school systems.
Thanks.
Stacey, one of the questions that I've continued to hear recently is coming from larger employers, and I think there just seems to be a lot of confusion and misinterpretation of guidance, particularly around isolation and quarantining. And I know a lot of those folks tune into these briefings to catch the updated information. And for those folks who have tuned in, who are asking those questions, can you just give a quick reminder to that process of someone has been exposed in a conference room, what the guidelines are for isolation and quarantining?
Great.
I know that's really basic, but I'm getting a lot of it.
I will try my best to do sort of a one layer type. But if you were exposed to someone who is a positive case, the quarantine criteria is going to be based on your vaccination status at this time. So if you are exposed and you're unvaccinated, your quarantine is usually 14 days. There are options for a lesser quarantine, but that means that you have to be asymptomatic, don't have any, through that time period, not having any symptoms. And so there are criteria that get you a lesser one. If you are vaccinated and exposed to someone who is positive, the CDC guidance is no longer that you have to quarantine, but you do still have to self-monitor for symptoms. And we do recommend that 3 to 5 days after the last exposure, you get tested. And so that's the pretty basic one. It goes into, that criteria gets pretty weedy if you're unvaccinated and trying for a lesser quarantine. But that's the basic piece of it.
Thank you. I really appreciate it.
Just a couple kind of follow-up questions. In terms of the sort of suggestions Jasmine was making, I think part of what we're interested in is, we do have funding set aside from ARPA. Again, got to check all the eligibility stuff, but whether it's that fund, those funds or others, of course, we just, we want to do anything we can to help continue to get the vaccination numbers up. So there's been all this work done, continuing work. So it seems like one of the questions that folks are asking themselves is like, would there be maybe some new tactics, or if there were some additional resources that we were willing to kind of invest into this effort, any new things that we might be able to kind of layer in on top of what we're already doing to potentially reach more people and try to move some more people? 'Cause is it correct that by the fact that we know who's been vaccinated in Buncombe County, right, for we know who those folks are. I'm saying this, but it's really a question. We also kind of know who hasn't been vaccinated yet, right? Like we actually know who those people are in the community. So if we were going to invest some additional resources in community outreach and education, would it be possible? And there were some funds to go along with it. So in addition to the free media resources that the counties used, our website, our partners in the media, things like that, like if there are different events going on in the community for vaccination, might there be opportunities to do sort of targeted outreach to these folks who we know haven't gotten vaccinated yet, but perhaps, there's reason to believe, very well, haven't completely closed their mind to it and might very well be willing to do it under the right circumstances. And if they're perhaps getting more information about, here are the easy, really convenient opportunities coming up to do so. So those are just kind of some of the ideas I hear folks kind of talking about that we, and it's not just public health, but I'm thinking, can the county's community engagement folks and everyone kind of think about if there were additional resources available, what might some promising strategies potentially look like?
And are you
I'm just
asking
kind
for
of throwing that
an
out.
answer?
I'm not getting like a real detailed answer.
Thank you. That's one of the things we can look at to bring back
Yeah.
next time, because we need to study that. And I do want to say that staff was actually watching this, so they were able to respond and tell
Okay.
me that, yes, we could use some of that contingency
Okay.
money.
Okay,
for that.
great.
So I wouldn't need a budget amendment. We'll just need to get a plan from the HHS of how much money we'll need, and we can use some of that
For
million.
the incentives?
Yes,
Great, so that can just be continuous.
yes,
No further action required.
right. And so if the state does sunset their program, then we can pick up immediately. And if the state continues, then we would hold off.
And on that point in particular, I'm just kind of curious, Stacy, to what extent if we have, I don't know if there's any research on this or if it's more maybe just sort of anecdotal observations or a sense from the staff who've worked on it, like how much that particular incentive has helped move people to do it. Is the sense that like it has moved people, or the folks, or is it more like the people who did it were happy to get the bonus, or that like, I don't know, any way to quantify that? I mean, 'cause I'm certainly happy to support it or maybe even expand it, depending on, is it an impactful incentive in this process?
We think so. So we did see on average a twofold increase when the incentive program went into place. The state continues to monitor and evaluate it. I can ask if they have any new data around statewide, how it moved people. I can tell you anecdotally, yes, folks came in saying, is it too late to get one of those incentive cards? So we know that folks were coming specifically once the dollar amount changed. That seemed to make a big difference. And that we started in the program once the dollar amount changed to 100. But what I hear from folks across the state is that they were in the program longer when it was 25. They saw their numbers increase when it moved to 100. So there was this, I guess the threshold had been met where it made it much more motivating and enticing and more desirable to do. So we do know those things. I'll be glad to ask DHHS if they've got any new qualitative and quantitative data from their evaluation of the program from the time it started and after the dollar amount changed. But I do appreciate the recommendations about how to reach others. I'm thinking through my brain right now, particularly around messaging and communications, particularly for 18 to 24 and then 24 to 49, because those tend to be our workforce, also tend to be our rates of higher infection, and how to motivate and how to reach those folks in innovative and creative ways.
What else do you hear anecdotally about why people are showing up now?
It's still, one is the incentive card, two, still that someone they care about or someone who loves them told them it was time to get vaccinated. The increase in cases, that still is the one of the drivers as well, that folks have said that when we had that summer, the beginning of the summer lull, that they thought they would be fine, that it was going to go away. And then as the Delta variant increased, they felt a bit more vulnerable. And so those are typically the reasons folks are coming in.
Do you hear anyone talking about workplace-related policies, or is that not rising up as a?
I have not had that rise up yet.
Okay. Thank you.
All right. Thank you, Stacy. And Dr. Hathaway, thanks for being here as well.
Thank you. I appreciate the opportunity to be here, as always, and it's a privilege to be able to update the community on what's happening in Mission Health System. First and foremost, I want to shout out a huge thanks. We have been in this for 18 months plus now, caring for patients in our community. A thanks to Stacy and her team at the health department, who've been just fantastic partners to work with. Avril and the gang. It's really been, it's one of my silver linings of the pandemic that we've developed closer relationships. It's a tragic shame that it's come at the cost of so much suffering to so many people, but we're thankful for that. We're especially thankful to the individuals throughout the community, to the commissioners here who've shown as much dedication as any elected group towards fighting this. And it's really a partnership that I've grown to appreciate. I want to run through our numbers a little bit. And this is augmenting and sometimes repeating some of the information that Stacy presented to you. This is the running 7-day average in North Carolina as of today. You can see that there is a slight improvement in terms of the number of cases compared to 14 days ago, is down about 26%. And if you'll notice to the right of the slide on the red line that the slope or the steepness of the curve is leveling off. That's reason for optimism on my part, and I'll share some other similar looking graphs. I'm hesitant, Stacy used the words cautiously optimistic. I'm worried that the opening of the schools and that the Labor Day weekend, I'm a huge football fan, and if you watched any of the football games, you'll notice there was nary a mask to be found. And that gives me great pause that this is not a trend that necessarily will be sustainable. But that being said, we're down about 26% in terms of the rate of the rise. This is HCA data that I'm sharing with you here that looks at 3 separate groups. One is all of HCA. That represents our 187 hospitals in multiple states from Alaska to Florida. We have a high concentration of hospitals in Texas and in Florida. And I think those of you who followed this closely know that that's where the pandemic has really taken off with this most recent Delta surge. And I'm encouraged by the downward slope. We are seeing a decrease in numbers of hospitalizations across the board. The right-hand graph, I believe, is one of our Florida divisions, and you can see a downward slope there. And the bottom graph is a zeroed-in look at what we're seeing here in North Carolina. This represents the hospitalizations in our 18-county region. And you'll see that while we have not rounded the curve as they have in some of the other divisions, it does look to me that we're flat. I don't know if that's the beginning of a downward trend or not, but we're hopeful and we'll see what happens. This is a blown-up view of what's happening exactly at Mission Hospital as of this morning. Again, goes back to last March where we were, anxiously awaiting the onslaught and unfortunately saw that with the peak in January. You'll note that the rate of the rise in this current surge that began right around July 4th was steep. We've had some ups and downs. I don't know if we're plateauing or not. And our ICU numbers in ventilated patients, ICU is in orange, and gray are the number of patients on ventilators, is really at a high for the pandemic at this point in time. I think it's really important to understand that 90 to 95% of all those who are hospitalized right now are unvaccinated. And so echoing the theme that you all have put forth, what we can do to get people vaccinated is critical and key. Short of that, masking is huge, and that the patients in the hospital who are sick and who are dying are the unvaccinated, not the vaccinated. Vaccinated people can get infected, but the severity of the illness is dramatically reduced. The next three graphs will have this similar format, so I want to orient you to that initially so you can understand what we're looking at. These are our test results in our labs by age group. The youngest are represented by the blue at the lower half. Orange is the 25 to 44 year age group. Gray is 45 to 64 years of age, and then the orange is those older than 65 years of age. And you can see that back in July, we were less than 10 cases a day diagnosed in our labs, and we have, gone up dramatically in all age groups, and these are all tests in any of our facilities. You'll note that the biggest increases tend to be in those in the 0 to 24 and 25 to 44 year age group. Keep that visual image in mind because I'm going to break it down here in a moment, where you can see that this is the outpatient setting, all the ambulatory lab, emergency department, and other labs. And again, it's that 64 and under that's risen, not the elderly group that has seen the rise. And then when you look exclusively at the inpatients, those who are hospitalized, it's a dramatic shift. So see this picture versus this picture. Cases are rising across all age groups. Hospitalizations are predominantly in the 45-year-old group and older. So it's really, and these are the vast majority of these who are hospitalized here, as I said previously, are in the unvaccinated category. We've gotten a lot of questions about our pediatric hospitalizations. We have not seen very many, just to be honest with you. I think the most that we had in the hospital at any given time was 3. We're typically averaging 1 to 2 children who are hospitalized with COVID. The other question we've gotten a lot is, have we seen any deaths from in our vaccinated population? We have not, to my knowledge, unless someone has misinformed me, but I tried to get that data, and we have not seen a vaccinated patient die. It has happened in the country, but it has not happened here locally, so it's wildly protective for us. I have just 2 more slides I want to share that look closer at mortality so people can understand what the death curves have looked like. This is an epi curve that shows deaths per day going back to the pandemic. The dates are plotted along the bottom axis, and each blue bar represents the number of deaths that occurred on that given day. Taller the bar, the more deaths. The closer the bars together, the more deaths that were day after day after day after day. So if you look in the January, which is in the middle section, and I apologize that the writing is so small, you'll see that we had up to 5 and even 7 deaths at our peak on a given day in the hospital in that previous, the third wave of virus infection that we saw. We went for a number of months, if you look out towards the right-hand side of the curve, May and June and July, where we saw 1, 2, 3, 4, maybe 5 or 6 deaths total in a 2-month period. And then it's not surprising to me nor to anyone, it shouldn't be surprising, as the cases increase, the hospitalizations increase, the deaths follow, and now we're beginning to look again like we did in January. Similar data, just plotted in a different way. This represents cumulative deaths. So the denseness of the color together represents deaths day after day after day. You see in December through February, many deaths, many days, multiple deaths on a given day. We did very well as we had vaccines put into people, stretched out the number of days in between deaths, many days without deaths, and then boom, August 1st hits, and we're on this fourth wave with the Delta variant, and we see a rise. I don't think the slope of the curve or the denseness of the bars is much different now in this current wave than it was in December and January. I think it's important to remember that Stacy pointed out that overall, the death rate is lower. It was 12 per 100,000 in January, I think, if that's right, and then 4 per 100,000 now, or a little bit less than 4. So that's encouraging. I think that's representative of the fact that we're seeing many, many more cases, but the elderly people, we have over 80% vaccination in those who are most vulnerable, and that's really good news. And that should encourage everybody in the community to get that vaccine, and whatever incentives we can help to provide, we'll do. Happy to take any questions.
Thank you, Dr. Hathaway. Would you mind going back a couple of slides if you can? I appreciate you sharing this information. I think there's some, yes, that one. So this is just for Mission Hospital.
This is just Mission Hospital.
Okay, and I know we can't read all the detail, on it, but just to help us interpret it, this is updated through September the 7th, right? I'm reading the headline now.
Yep, through yesterday.
Okay, great.
Well, this
I really
morning.
appreciate you sharing that information. As you know, the information that's on the state dashboard, there's a much bigger kind of delay in the reporting on that. So I appreciate you sharing this with us today so we can kind of get an updated, get this updated information, especially in this context of, as the chart shows, that there has been this significant increase in, unfortunately, the number of folks who are dying of COVID in the hospital. So thank you for sharing that. I appreciate you bringing it.
And I would think, just to elaborate on this a little bit, that I would expect, while the mortality rate has declined over time significantly, in January and February and March of last year, if you remember, we saw tremendous numbers of deaths early on in New York City when health systems were overwhelmed. We didn't know how to treat it very well. I think we will be very similar to what we were for hospitalized patients in January. I think that death rate will be the same, but there'll be many, many more cases that never make it to the hospital. So we'll see hospital numbers which are the same, while I think overall mortality rates will be lower. Once you get to the hospital, it's a bad situation. And again, these are the unvaccinated.
Yes. And that all makes sense to me, but it is also, I mean, those are alarming numbers, though. I mean, just because it's not quite as bad as December, January. I mean, December, January was so bad. I've spent some time just kind of going back and looking at this over, from time to time, and it's with about 350 deaths in the county over the course of this whole pandemic, but they're not evenly spread. That period, and when we've had these peaks, there's like a very high percentage of the deaths occurring in fairly small percentages of the overall time frame. And we're in another one of those now. We don't know exactly how it'll play out. I hope you're right that it's going to be leveling off, and maybe we see more positive trends. But it is I feel like we talk about this stuff so much and all the things that were being done, but in some ways, I think it's like when a lot of people start dying, I think it is kind of this wake-up call. Unfortunately, maybe one of the few things that kind of causes some people to be jolted into, the stuff I was hearing about, you don't really get that sick, and, things like that. People start realizing that that's not always true.
No, it's not true.
Very serious, and we really are. And these aren't all just, as you mentioned, it does skew towards the older residents, but these are the folks who are at Mission Hospital. It's not nursing home residents. It's people who are generally from a healthier and younger group who are getting very seriously ill. And
That's absolutely right. The age demographic has shifted so that our hospitalized patients are far younger than they were early on. Again, that's reflected the fact that we vaccinated the elderly, and so now we're left with the others. And we've had, I think our youngest death for us was a 28-year-old person, and we tragically had the death of a woman who was pregnant and delivered prematurely, and then died, leaving the newborn baby without a mother and the 2 kids at home without a mother.
so sad.
It always has been serious. It's just reemphasized by the current surge. If the death rate in the United States right now overall is about 1.62%, which means between 1 and 2 people out of every 100 who get the illness will die. And that's 10 times greater than influenza. We've had more deaths from COVID in this epidemic and pandemic than we have in 10 years worth of flu deaths. So people who think that this is the flu, it's not the flu. It's far worse than the flu. And the risk in the school-age population is not that they'll die, but they will then transmit it to their mothers and fathers, aunts and uncles, grandpas and grandmas, and those are the ones we have to protect.
Right.
Dr. Hathaway, I appreciate you sharing the local death numbers. I think that's a great way to build trust within the community and the hospital. So thank you for being willing to share those most current numbers. You specifically mentioned the 4th of July spike, and we're just coming back from Labor Day, and you mentioned college football. We know there's a lot of folks out doing things. Can you, and maybe this is a Stacy question too, give us any type of idea of what we could specifically expect to see after another long holiday weekend?
So every holiday that we've had so far was followed actually a little bit earlier than I would have expected. We say it takes about 10 to 14 days before we start seeing increases in hospitalizations, but it's really 7 to 10 days where we actually started to see the rise. So I suspect that we will see a rise. I think with the opening of schools, we'll see a rise in cases for sure, because there's an unvaccinated population that's back in school and they'll get the cases. I'm hopeful but pessimistic that that's going to translate also into an increased number of hospitalizations. And I suspect that'll manifest within the next week or so.
Thank you.
Yep.
Dr. Hathaway, I have one question, but before I'd like to just say that echo again that we appreciate the nurses, doctors, everyone at Mission, what you're doing. And we know too how this is wearing on your staff. It's got to be. But the question I have is, let's set COVID aside, and let's talk about the people who might have strokes, heart attacks, other illnesses. I was talking to a church member of mine who's got to have elective surgery, who's had it put off now for the second time, and he can't have it now until October. But how is this taking its toll on the rest of the patients or the rest of the community outside of COVID?
It's taken a significant toll, and it's been unfortunate. What we saw early on in the pandemic was that there was a decreased demand overall for services. People put off what they would normally do and stayed away from the hospital, much to their own detriment in many circumstances. What that did was create capacity. We had plenty of space in our health system for all the patients who needed. Even in January, while we were full, we weren't at or near capacity. As time has gone on, all across the state, our demand rose, and now we've been hit with the COVID surge on top of demand for health care that had already come back. And so that's put us all, every hospital in the state, at near capacity for our care. We have been able to handle it to this date, and we'll continue to handle it, and we certainly have protocols in place to care for the most critically ill and the sickest of the patients, but it's been a challenge. We have been limited in large part by not so much physical space as staffing resources all across the board. I saw today that there's an estimated 15,000 person shortage of nurses in the state of North Carolina.
Wow.
And that creates huge demands, not just on availability of care, but demands on the people who are continuing to provide the care. They're burning out, they're working hard. It's been emotionally and physically difficult for them. So while it may not be everything, the words of thanks and praise and what we can do to support them is certainly needed. We need more people in the workforce.
Thanks.
Dr. Hathaway, I have a question about kind of community-level vaccination efforts and goals. So I, like everyone else, I expect I'm reading a lot about how states and communities and cities that have higher levels of vaccination are more likely to keep their schools open, have less hospitalizations, all of the good things that come with high levels of vaccination, which is intuitive, I hope. In your experience, I guess, looking across HCA-wide, nationwide, is there kind of a minimum level of the adult population or community population that you're seeing to?
The herd immunity question, I guess.
I'm not quite asking about herd immunity. I'm not sure I know what that term means anymore.
I don't think any of us do.
Something close to that is what I'm asking about.
Yeah, well, there's an interesting graph I just happened to see today where they plotted vaccination rates against infection rates. And while it's not perfect, it's clear that the higher the vaccination rates, the lower the rates of infection across communities. The more, more is better. I'm worried, if you look at the way the Delta variant is progressing throughout the country, it has started, unfortunately, in the South, and it is marching northward, much like we see other viral illnesses, flu, measles, whatever the case may be. It has a very visible geographic spread. And I think that while some of these more northern communities, albeit they do have slightly higher vaccination rates, I think it's just a matter of time before it homogenizes and we don't see such disparateness across different states. But there is, without a doubt, higher vaccination rates are protective for your community, and masking is almost as effective as vaccinations. A little bit less so with the Delta variant than with the Alpha variant, but it's still highly, highly effective.
Thank you.
One additional comment. There were some questions about booster shots, and I think it's important to emphasize that the booster shots, are widely pushed by the Biden administration as the next step, and Dr. Fauci and the CDC and others have endorsed that too. There is not definitive guidelines about who or how or what or when or where. The guidelines currently are looking at 8 months after your first vaccine administration, and that's for the Pfizer vaccine. The data for Moderna has not been fully analyzed, and nobody knows exactly what to do with Johnson & Johnson at this point in time. So we will work cooperatively and collaboratively. We have what we call our Western North Carolina Vaccine Acceleration Consortium. Stacy and I and many, many others in the 18-county region are part of that, and we'll partner to bring a plan. But that's going to be another major effort that we're going to have to be prepared for once we start giving the booster shots. To Brownie's question, I think that's an opportunity to push that campaign, or maybe it was Jasmine's, to push the campaign for additional first doses for people when we get into the booster side of it too.
Dr. Hathaway, I'll echo the thanks to you and to all of your colleagues for the frontline work you're doing. We are talking with all of our large partners in the community about vaccine policy for employees, and would like to kind of take a few moments to revisit that topic with you. I know we talked about it last time you were here. I think, I think from a county perspective, certainly we are trying to explore different strategies and tactics that can spur, the employee numbers to rise. I'd like to hear sort of the update on the current policy at Mission, and then current thinking about whether Mission would join many of the other large major health systems in the state in having a vaccine, or having a vaccine for clinical employees, which is sort of a way some people have parsed the policy to try to guard against the fear of losing non-clinical workforce as part of a mandate.
Yeah, it's I wish we had an hour to talk about this and not just, state our positions, but really brainstorm about what the right thing for the community is. Again, as I've said previously, right now we do not have a vaccine mandate in place. The reason to have one would be to keep the workforce on the job. We are seeing, right now we have 60, give or take, employees out who have COVID of our 10,000, so it's a very small number. And I think about 40% of them actually have been vaccinated. So they're not ill, but they're out. We balance that, and I don't believe that there's transmission to patients or from patient to patient within our facilities, because we have universal masking everywhere you are, and we sit 6 feet apart when we eat. We do all kinds of preventive measures in the hospital. The downside, as you alluded to, is the workforce, and we're watching very, very closely in communities which we consider similar to ours, including within our own community, how that's affected their people and whether they're leaving or not leaving. If we put in a vaccine mandate and have a shortage of staff because of that, that doesn't serve the global purpose that we're all after. If we fail to do it and people get infected and they don't need to be, that's a problem. So it's a balance we talk about daily. And, you know, we just push and support each and every one of our staff members to get vaccinated as soon as they possibly can.
Are you all considering some of the steps that, you know,
Every day.
Okay, well,
Yep.
I know this isn't the forum for debate, but I do think every large employer in our community has an opportunity and in some cases a responsibility. And, you know, it's just very hard to look at the recommendations around this and the choices that large hospital systems within North Carolina serving very diverse communities have made and understand why Mission's not going there. I hope that you all in continued discussions will make the decision to make that.
We'll talk very closely with our staff and get their opinions. We'll talk with the union. That's not a trivial consideration. And we'll put it together and try to make the best plan for everybody.
I appreciate
But we
that. Thank
appreciate
you.
that viewpoint and your support on this.
So Commissioners, obviously, this is a really important conversation, and I don't want to curtail it. We do, but I also just want to acknowledge the other items on our agenda too, which so we're either going to need to maybe schedule some additional time for them, or we're going to need to move on to them. So just wanted to say that if there's other things people really want to get out on this, there's nothing more important going on in the community right now, so I don't want to cut this off, but I just want to acknowledge we're a little behind in our agenda. So
I did have a resolution related to vaccinations and COVID. I was hoping to read to the board, and I'm happy to do that now, or I can do that during the open discussion portion at the end if there's time, or.
why don't you go ahead and do it now? And so I think we should just try to go ahead and complete anything else that's on this, because I don't think we have anything else under open discussion, so let's just go ahead and do it now if you'd like to do that.
Okay. Yeah, I just, I put together a resolution, which is a collection of thoughts related to imploring employers across the community to consider various vaccination incentives and mandates, and also kind of calling out 3 important public institutions specifically. And I'll just read it quickly and then stop talking.
Okay, and just for clarification on the process, Commissioner Sloan, you're not asking for the commission to act on any of this today. It's just something you wanted to share sort of for future thinking of the commission. Okay.
Perhaps too formal, food for thought, yes.
Okay, cool, all right, thank you.
So starting with the whereases, all the coronavirus vaccines currently in the U.S. have proven to be safe and effective, with over 200 million individuals receiving a shot. The vaccines are remarkably effective at protecting both the individual and the broader community through reductions of transmission and hospitalizations. On August 23rd, 2021, the FDA gave full approval for the Pfizer vaccine, whereas it is the civic and moral responsibility of every adult to protect children who are not yet vaccinated against COVID-19, as well as the responsibility of medical personnel to protect the vulnerable, their patients, the community, and themselves through vaccination. Whereas the American Hospital Association, American Medical Association, and the American Nurses Association supports vaccination mandates of various forms for employees and medical personnel. Also, whereas on August 12th, 2021, the National Educators Association announced support for educators to receive the COVID-19 vaccine or submit to regular testing. Also, whereas a recent survey from Willis Towers Watson found that 52% and growing of U.S. employers will have a vaccine requirement in place by the fourth quarter of this year, which is a dramatic increase from the current 21% of employers in the United States. Now therefore be it resolved, the Board of Commissioners for the County of Buncombe, the following 3 items. That the Board of Commissioners hereby request Mission Hospital executives or immediately identify their staff and contract staff who are not yet vaccinated and implement the vaccination requirement within the next month. And the same goes, each of these are identical, for Asheville City Schools and for Buncombe County Schools, faculty and staff as well. There's just a couple things, this is a draft, these are my thoughts. A couple things I'd like to see added, which is a simple, item at the end, which would implore all employees to follow suit. I'd also consider adding Asheville Buncombe Technical Community College to this list. And I just say, I'll just describe my intent, and which is, not to force anyone to do anything in terms of employers, nor is my intent to define for people what the definition of a vaccine mandate is. That comes in very many different forms. There are different various items and incentives, carrots and sticks that people can use. My intent here is to tell and to ask certain employers that now is the time to try things to incentivize their employees to do this. So that's that.
All right, Commissioner Sloan, thank you. And I think I'll just take the last word and just say, thank you all again for being here. Thanks for what everyone's doing. And I also wanted to say thanks to the county manager for the updates we've been receiving about, because these are issues that we're wrestling with in our organization too. We're a large employer as well. I think that our numbers show that we do have we're probably doing relatively well on the vaccination rates compared to community as a whole. So thank you everyone who's helping to meet those goals. But our numbers aren't where we want them to be either. So we appreciate the strategies that staff have developed to help continue to ramp that up and the updates on that. And my sense is that I hope that they they continue to move people. And I think getting the numbers up is really, we have to do that. I hope the current efforts are successful in getting us there or very close to there. If they aren't, I think we're also gonna, as an organization, have to consider other policies, around how we continue to get something closer to universal vaccinations as well. So, but I wanted to say thanks for all the work that's going into that and some of the promising results that we're seeing from some of the new initiatives.
Thanks. Commissioner,
Yes, ma'am.
I would want the board to consider at the 5 o'clock meeting, a discussion on the incentive program.
Okay.
If you can say yes or no, how much money you want us to set aside. You don't have to do a budget amendment, but some guidance that you want to put that in place would be helpful.
Okay, so we'll add that, if there's no objections, to at least have some discussion around that for new business. Okay, and that sounds great, Avril. All right, commissioners, we do need to move on, so let's go ahead and